Hello pregnant women, I'm Razan. In this video I'm going to discuss with Salsabil some points that help you to get preparing for birth, mentally, physically and practically, to receive the expected gates. Let's start with the first one.
Psychological readiness. Psychological preparation for childbirth is the most important step of preparing for childbirth. So stay away from things that increase your stress and don't let negative thoughts sneak into your heart. Relax and think about your little one only and imagine what his futures will be, and make sure that he too is waiting for you as you have been impatiently waiting for him. Some tips to psychologically prepare for birth. 1. There is no one right way to give birth. You will do what feels right for you at the time, and it is only then when you are in that situation and experiencing the birth process that you will know what that truly is. Antenatal classes can be very helpful to assist you to know and understand what your options are when giving birth. Example, pain relief, birthing position, and different ways that you may handle the stage of the birth process. There are also podcasts and television series which will give you an idea of the many diverse ways that women give birth. However, it is only when you are in the situation that you will really know what feels best. So be open to this and be prepared to go with the flow. 2. Things can happen beyond our control that are no one's fault. It's important to remember that things can happen during the birth process that may not be as we have planned, hoped for, or anticipated, and in most instances, these are situations that are beyond our control. For example, baby may arrive early. The baby may get into awkward position. Your blood pressure may rise or fall. These are just a few examples on the number of things that can happen to anyone. They are beyond our control and are no one's fault. 3. Focus on the end goal. No matter what happens or how close or far your birth experience ends up being from your ideals or your birth plan, the focus is to safely birth your baby or babies and to work with the health professionals to make this happen. Follow up breastfeeding with your midwife. In the last month of pregnancy, it's the best time to start following up with midwife who specializes in breastfeeding so that you are trained on how to stimulate the nipple for breastfeeding and the correct position for breastfeeding.
Firstly, how to stimulate the nipple. Your baby natural movement at the breast make for the most organic stimulation method. Your body automatically responds to the flutter and sucking motion of your baby mouth. If you need to control your milk production or stimulate let down manually, use a breast pump. Attach the pump to your breast and begin the expiration process. The sucking sensation of the vacuum attached to your breast can help stimulate your breast to cause let down. Secondly, what are the correct positions for breastfeeding? There are many breastfeeding positions that may work for each mother. An important consideration or breastfeeding tip for the mom is that she always feel comfortable. In general, the infant should be positioned so that they are facing the mom's body and their head, shoulders, and the hip are in alignment. Some of the most commonly used positions include cradle position, cross-cradle position, clutch position, and side-lying position. Cradle position. The cradle hold is the most common breastfeeding position. The mom arm supports the baby at the breast. The baby head is cradle near her elbow, and her arm support the infant along the back and the neck. Cradle cross position or cross-cradle position. The cross-cradle position uses the obese arm to the cradle position to support the infant, with the back of the baby head and neck being held in the mother hand. Her other hand is able to support and shape the breast if required. In this position, the mom can guide the baby easily to the breast when they are ready to latch on. Clutch position. The baby is positioned at the mother's side with their body and feet tucked under the mom's arm. The baby's head is held in the mom's hand. The mom's arm may also rest on pillow with this held. This position may be advantageous for moms who have undergoing CS. Since it applies no or limit weight on the mom's chest and abdominal area. It also works for low birth weight babies or babies that have trouble latching since their head is fully supported. Side lying position. The mom lies on her side and faces the baby. The baby's mouth is in line with nipple. The moms may also use the pillow for back and neck support. This position may also be advantageous for mom who have undergoing CS since it placed no or limit weight on the mom's chest and abdomen area.
Exercise to facilitate childbirth. Ask your doctor about the appropriate exercise for you to facilitate natural childbirth. And don't practice a certain type of exercise on your own without first consulting your doctor, and make sure that this type of exercise is appropriate for your condition. And you can attend yoga session to control the feeling of pain and practice breathing methods that help facilitate childbirth. 5 exercises to train for labor and delivery. Exercise can prepare your body for an easier and perhaps quicker delivery, and it can help you return to your pre-baby weight sooner. 1. Child's pose. This yoga pose helps lengthen pelvic floor muscles and ease discomfort. Kneel down and sit on your heels. Then lean forward slowly and walk your arms out long in front of you. Breathe deeply. You also can rest your elbow on the ground in front of you with your hands supporting your head. As your belly grows, you may need to spread your knees farther apart to create space. If it is uncomfortable to sit your backside on your heels, you can sit up higher. Take care to not raise your hips above your heart. Talk to your physical therapist for other guidelines specific to you. 2. Deep squats. Deep squats help relax and lengthen the pelvic floor muscles and stretch the perineum. Stand with your legs wider than hip width. Slowly squat down as far as you can. Go with your hands pressed together in front of you. Your physical therapist can talk with you about how often and how many deep squats you should do. 3. Quadruped cat-cow. This yoga pose helps ease discomfort and decrease lower back pain. Get on your hands and knees. Exhale and round your back as you tuck your chin toward your chest. Then inhale and gently arch your back downward and look up the sky. 4. Perineal bulge. This trains you to push during delivery without holding your breath. Holding your breath while pushing is called Valsalva. Valsalva can decrease the rate of blood flow back to the heart, lower maternal blood pressure, decrease maternal blood oxygen and blood flow to the placenta, and increase the risk of injury. It is also can increase fetal head conversion and fetal distress. Parental bulges should only be practiced in the last 3 weeks of pregnancy. Don't practice them often because it can place excessive pressure on your pelvic floor structure. 5. Perineal massage. Perineal massage lengthens and softens the tissue of perineum. You can start this 35 weeks of pregnancy. Perform this massage techniques for 10 minutes once a day. Prepare the birth bag. Start preparing the special bag for the newborn that you will take with you to the hospital, and make sure that you have all its supplies as soon as the 7th month begins, so that you will be ready for childbirth at any time in the event that you are surprised with sign of a premature labor. And don't forget to put your personal items that you will need in hospital. Here's what to pack in your hospital bag for labor and delivery. Our handy checklists include all the essential for your baby and you. What is essential for the mom to be? A picture ID, your insurance card, and the name and phone number of your baby's doctor. Check with the hospital or birth center ahead of time regarding any paperwork you should bring. Ask if it would be helpful for you to bring a copy of your medical records. Your birth plan, if you have one. Bring extras in your go bag so that everyone on your medical team can have a copy. Toiletterize, pick up your personal items such as toothbrush and toothpaste, lip balm, brush, comb, makeup, and hair ties or headband. Hospitals usually provide soap, shampoo, and lotion, but you may prefer your own. Because space can be limited, consider decanting your toiletries into smaller bottles. A hanging toiletry bag can be helpful. Eyeglasses if you wear them. A bathrobe, nightgown, or two. Slippers and socks. Hospitals and birth centers provide gowns and socks for you to use, but some women also bring their own. Choose a loose, comfortable gown that's either sleeveless or has short, loose sleeves so that your blood pressure can be checked easily. Cell phone and charger. A notepad or journal and pen. It's not just a place to jot down thoughts and reminders, it's where you can also track your baby's feeding sessions. Write down questions for your provider, note what the pediatrician tells you, and so on. Some people bring a baby book so that they can record the birth details right away. Whatever will help you relax. Possibilities include your own pillow. Use a patterned or colorful pillowcase so it doesn't get mixed up with the hospital or birth center pillows. And remember, it may get stained. A picture of someone or something you love. Essential oils. Get permission from the hospital or birth center ahead of time, and anything else you find comforting. A cord blood kit if you're planning to bank or donate your baby's cord blood. Essential to pack for your baby. Installed car seat. You can't drive your baby home without one. Have a rear facing car rest probably installed ahead of time, and know how to buckle in your baby correctly. Baby nail files, clippers, and our mittens. Some infant hospital gowns have a little built-in mittens to keep babies from scratching themselves, but you may want to bring baby nail files or clippers to trim tiny nails, or back mittens from home. Outfit for baby pictures. Many hospitals and some birthing centers offer newborn pictures. You might like to pack something special for your baby to wear for these photos. Baby clothes for the hospital stay. Your baby can wear the pajamas or slippers provided by the hospital, but you can dress her in baby clothes of your choosing if you like. Coming home outfit. Your baby will need an outfit to go home in, including socks or boots if the clothing doesn't have feet, and a soft cap if the air is cold. Pick a fleece jumpsuit and mittens too. Make sure your baby's outfit has legs so that the car seat strap can fit between them. Some burp cloths or cloth diapers for catching any spit up while burping your baby. Receiving blanket. The hospital or birth center will provide blankets for swaddling your baby while you're there, but you may want to bring your own to tuck around your baby in the car seat for the ride home. Make it thicker one if the weather is cold.
Keep track of your condition with your midwife. Follow up your case with your midwife and share your thoughts and concerns with her so that she reassure you and give you correct information. Also ask her about the position of the baby and appropriate method for your condition. And in all cases, you must be psychologically prepared for natural or cesarean birth.
What is the importance of following up with a midwife?
First, follow up of the development of pregnancy first and make sure that the fetus growth is properly. Second, follow up of your health in general in terms of weight, blood pressure, and more. Third, follow up of the state of health before childbirth, the form, type, time of the birth. Fourth, follow up any pathological occur during a pregnancy and do the intervention related to your case. Follow up what happened during a pregnancy. 6. Follow up the fetus movement and making sure of its proper movement at the right time according to development of the pregnancy. Learning about the different signs of childbirth. As a midwife, we must encourage the woman to read about the sign of childbirth, learn the difference between labor and other contractions that aren't sign of labor, and ask the midwife what to do when you feel one of these signs. Now, I want to tell you and discuss 6 common signs to look for when the baby may be on the way. First, lining or baby drop. This means the baby is getting into head down position in preparation for birth. Second, strong and regular contraction. Near the end of pregnancy, uterine contraction start to move the baby down into lower position in the birth canal. The abdomen gets hard and hard like a basketball, then it's relax. Related to contraction, I want to tell you how to differentiate false labor contraction from real contraction. If you have more than 6 contractions every hour and they become stronger and the rhythmic, meaning they occur at a regular interval, then pay attention because the baby is on the way. Third, your water breaks. The fetus has been growing and develop in your amniotic fluid. Your water can break day before labor start, during labor, or not at all. Once the water breaks, the baby is no longer surrounded by productive fluid and could be at risk of developing an infection. Fourth, lower back pain and cramping. Cramping in your pelvic and rectal area. You may also feel dull ache in lower back. Fifth, a bloody vaginal discharge. This discharge is caused by the release of a mucus plug that blocks the cervix during pregnancy. 6. Diarrhea. That means a frequent visit to bathroom caused by increased pressure in your pelvic and bladder.
Choose the right hospital for childbirth. Talk to your midwife about the available hospital for childbirth. And it is best to choose hospital close to home so that you can go to it quickly if you feel any sign of labor. Providing a special place for the newborn. Create a comfortable place to receive the newborn at any time. Make it on shelf and arrange its clothes and small items so that you can easily access them after birth. Thanks for watching. This video was done under the supervision of our amazing teacher Taroub Al-Lataife. Thank you, we appreciate your efforts.